Let's talk about this. 45-year-old man goes to a clinic because of his left knee is swollen and painful, and he was in Connecticut. What did that tell you? This is so unhinged, but it's kind of fun. Connecticut. What does that tell you, guys? Connecticut tells you maybe there might be some Lyme disease. That's right. So in step 1 land, Connecticut, the Northeast, you got the Borrelia burgdorferi. It's the Lyme disease bug, right? It's common in Connecticut, New Hampshire, and it's going to be transmitted through the bite of the Ixodes tick. So anyways, yeah, we got facial droop. We got the Bell's palsy. That's what it is on the right side, and it's slowly improving over several weeks, and now the knee is his only problem. So what treatment, if he had been given it earlier, would have prevented this from happening? Okay, so the answer is going to be, I'll zoom down so you can kind of take a gander. It's going to be ceftriaxone. So when you have facial palsy during the early disseminated phase of Lyme disease, treatments such as antibiotics like ceftriaxone would have targeted the spirochete and likely prevented the development of the late Lyme disease. And that typically presents as articular arthritis, so knee arthritis. And the other choices like allopurinol, that guy is used to treat to lower the uric acid levels in gout. So Lyme arthritis is not caused by high uric acid levels, so it wouldn't be helpful. Next one, lamivudine, that would be associated with treating HIV, not Lyme disease. A Lyme disease vaccine was once available but discontinued, and this is no longer. It's not going to be a preventive option. So everybody would choose this. It's kind of a cheeky little answer, but yeah, that's unfortunately not going to be it. So when you think of maybe a live attenuated vaccine, yeah, there used to be one, but it had low sales, and so it had a recombinant outer surface protein from the bacteria, not live organisms, and so anyways, that's kind of a cheeky answer, but so if you pick that, it's totally fine. But yeah, there's no vaccine available anymore. Mefloquine, so that's an anti-malaria drug that does not affect Lyme disease. And then Metron, we freaking love Metron. That's used for anaerobic bacterial infections and contain parasites, and it's not effective against Lyme disease. So yeah, knee pain due to Lyme arthritis, and he had signs of Lyme disease when he had facial palsy, and it's been treated, or you could have treated it then rather with ceftriaxone. And so basically the super easy recap is we got Bell's palsy. Hiking in the Northeast makes us think of Lyme and the Ixodes tick. And what step 1 wants you to know is that the Borrelia burgdorferi is a spirochete, the spiral-shaped bacteria, and it's spread by the Ixodes tick in the Northeast in Connecticut. And that's all you need to know. It spreads in the blood. It can reach the brain and the heart and the joints. And if it's not treated, it sticks around and causes chronic joint inflammation, so inflammatory arthritis. Early rash, you could treat it with like doxycycline. Facial palsy could be treated with ceftriaxone. The IV, soaking across the blood-brain barrier and help out. Late Lyme would also be treated with ceftriaxone, but it's better if it's prevented earlier on. So yeah, anytime you see symptoms, definitely get treated immediately. And that's pretty much all there is to it. So like and subscribe if you want more of this content. Let me know what color I should change my background to. I'm thinking the red is just getting a little bit old, so.